So often we have the question which of the test we should be using, which of the statistical test we should be using. And the answer is that if we have difference between two things, for example, difference between averages, difference between means, then and the data is continuous, for example, height, weight, 1 2 3 4 5, like numbering, and we assume it to be normally distributed, मतलब parametric. So here we will be seeing if this data is paired or if this is unpaired. If this is paired का मतलब है कि we are doing before and after on the same particular group, mean blood pressure before and mean blood pressure after. So if the data is paired, then we are going to use paired t-test. And if we have more than two groups, for example, if we are going to see mean blood pressure in the patients of Pakistani descent and African descent and American descent and Irish descent, for example, we have four groups now, then we will be doing repeated measures Anova. Now if again we have a continuous set of data, then we assume that this is normally distributed, but now this is not paired, this is unpaired. This means that we are going to we are going to see the average of two different groups. For example, one patient who opted for surgery and other who went for the medicine, and we are going to use unpaired t-test. And if there are more than two groups, for example surgery, medicine and physiotherapy, then we are going to do one-way Anova test. Okay, then if we have ordinal data, ordinal means that it has good, bad or best, mild, moderate, severe, or on the pain scale, how much pain from 0 to 10 a patient is feeling, and this is non-parametric, this is not normally distributed, then we are going to see if this is paired or if this is unpaired. If we are going to measure pain before and after a treatment on the same particular set or not. If this is paired, we are going to use Wilcoxon signed test. And if there are more than two groups, then we are going to use Friedman. For example, this is the mnemonic Wilcoxon signed and man fried. I just I just came up with this thing. Wilcoxon is the person who signed a paper, and on that paper it was written to fry some men in one particular region. So Wilcoxon signed and men get fried. So this is brain treatment which a group of patient is going to take, and this is before and after, and on the scale of 0 to 10 we are going to gauge them. So this is for paired data, continuous, Wilcoxon sign, man fried. And now if we have unpaired data, for example, different group of people who are going to take one kind of treatment, and then different group of people who are going to take different kind of treatment, and at the end we are going to interpret their results, then we are going to use Wilcoxon Mann-Whitney U test. And if there are more than two groups, Kruskal values. Okay, so mnemonic for that is that Wilcoxon Mann-Whitney, this person has two wives. So yes, this will be a 2 by 2 square. So it's not 2 by 2. And if Kruskal Valleys is something that I have remembered, I don't know, it just sounds more like Vicky Khushal. So Vicky Khushal is currently married to only Katrina Kaif, but he can have more wives, 3, 4, whatever. So Vicky Khushal is going to have more than two categories, and Mann-Whitney is only going to have two categories. Okay, then we come up to nominal data. Nominal data if there is difference or there is a relationship, we don't care, we just going with the nominal we are just going with the nominal data. Nominal is man, woman, gene 1, 2, or 3, or species 1, 2, or 3, or hot and cold, that kind of data. And if this is paired, for example, yes or no answers before certain treatment or after certain treatment, then we are going to use McNemar. And if more than two groups, then we are going to use Cochrane's Q test. I have not made mnemonics for these because these are very, very, you can say, least tested. And now, if they are unpaired and they are proportions, then we are going to use chi-square. Chi-square will also be used for more than two groups. Okay, then we have relationship based parametric test, and if they are continuous data and parametric, same as this particular rule, continuous and parametric. If they are going to be continuous and parametric, then we are going to use Pearson's correlation and linear regression for one dependent or independent variable. And if they don't make any sense, we are going to find relationship between two entirely different things, then we are going to use Spearman's correlation. For example, heart rate and pain, relationship of heart rate and pain. So for this particular thing, we are going to use Spearman's correlation. That's about it.